This video will review diabetes sick day recommendations. If your child is showing signs of illness, it's time to check for ketones. During times of illness, ketones may be elevated even if blood sugars are within their target range. Early detection and treatment of ketones is vital in preventing diabetic ketoacidosis. What exactly do we mean by illness? Feeling sick can mean a variety of different things, such as just not feeling well, like having a cold, or being very ill, such as having a fever or vomiting, or an infection, like a strep throat, perhaps a surgical procedure, like the removal of wisdom teeth. Illness could even refer to a serious injury, such as a broken leg. Any of these situations will require checking ketones every 4 hours for the duration of that illness. When we review the symptoms of diabetic ketoacidosis as compared to symptoms of a common GI illness, they can be very similar. Both DKA and a common stomach bug can result in nausea, vomiting, fatigue, and a stomachache. Testing for ketones when exhibiting any of these symptoms can help to prevent DKA. Once ketones have been tested, you'll use that result to determine your next steps. When using urine ketone test strips, trace or small levels of ketones can be treated by drinking several glasses of water. A sugary drink is not an acceptable alternative and will likely worsen the situation. However, broth or a sugar-free drink is an alternative to water. If ketones are moderate or large, additional fast-acting insulin may be needed. It's important to note that if your child has a low blood sugar, you should not give extra insulin even if ketones are elevated. When using a blood ketone meter, results will come in numeric form. A blood ketone level of 0.6 to 1.0 can be treated by drinking several glasses of water. Again, sugary drinks are not an acceptable alternative and will likely worsen the situation. However, broth is an acceptable alternative. If ketones are between 1.1 to greater than 1.6, additional fast-acting insulin may be required. If extra insulin is needed, contact our pediatric endocrinology team, either the diabetes nurse during the day or the pediatric endocrinologist on call nights, weekends, and holidays. You should also follow the sick day plan provided by your diabetes doctor. If your child uses an insulin pump and has moderate to large ketones, always disconnect that pump and change the infusion set immediately. Never give insulin to correct for ketones using a pump, even if you've just changed the infusion set. Always give fast-acting insulin with a syringe or an insulin pen. Remember to recheck the blood sugar and ketones in 2 hours to make sure that the new site is working well. If your diabetes doctor or care team has given you a sick day guideline sheet, please have it available for the following review. You can hit pause on this video if you need to go grab it. To utilize this sheet, you'll need to know the current blood sugar and ketone reading. In order to determine the correct insulin dose, you'll find the box that lines up with your child's current ketone and blood sugar level. For example, if the ketone level was large and the blood sugar was 350, you would give 4 units. Now, the doses shown in this video are just an example, so please use the dosing on the sheet that was provided by your diabetes doctor or contact the pediatric endocrinology team immediately for guidance. Doses given as an additional correction for ketones are calculated based on your child's weight and total daily insulin dose. If you'd like to learn more about sick day dosing, discuss it with your diabetes doctor at your next visit. Once extra insulin has been given, recheck blood sugars and ketones every 2 hours until those ketones are trace or negative and blood sugar is back to normal. If ketones continue to be moderate or large after retesting, contact the pediatric endocrinology team. Once ketones are cleared, you should continue to check every 4 hours for the remainder of the time that your child is ill.